Hi everyone. In the last couple of weeks, we've identified that we have a problem with patient flow. Sometimes it's a nurse not knowing whether a patient has been registered. Sometimes it's a provider not knowing that a patient is in a room and needs to be seen.
That's for sure.
Now, we had processes for patient flow through the office that used to work. We just seem to be having a lot of communication breakdowns despite using SBAR.
I think part of the problem is that some members of our team, like David, just don't want to use TeamSTEPPS tools. It isn't easy to talk with him about it.
You know, that may take some one-on-one coaching. Are you willing to have a conversation with him?
Yes, but that's going to be a tough conversation. Is there a TeamSTEPPS tool that can help me?
Yes. Remember the conflict resolution tool, DESC script? We can build the script together so you're comfortable speaking with him about the issue.
I definitely need some help.
Okay. First step, you need to describe the situation. Why do you want to talk to David?
Because he's not using the SBAR tool during handoffs.
So, it's important to imagine yourself in the other person's shoes when you're going to discuss an issue. How can you show David that you're trying to understand his perspective?
I could say that I noticed that he seems annoyed when we're talking about SBAR.
Great. So, on to the next part. How will you express your concerns about his reaction?
I tell him that by not using SBAR, he's causing some of the chaos in the office.
If you use a statement like that, though, you're going to make him defensive. How can you rephrase that using I statements to describe your feelings?
Well, I could say when he doesn't try to use SBAR, it frustrates me because I think that that tool can really help us.
That's great. So, next step. You need to offer solutions to improve the situation with David.
What if I suggested that we talk about why he isn't using SBAR?
Good. Then you two can come up with a solution that works for everybody. Sounds like you're ready to talk to him. Okay, let's do our morning huddle.
It's another full day. We've got a lot of patients to take care of and to move through the office today.
But I know we can do it. I know I was a little defensive when we first started using the TeamSTEPPS tools because I felt left out. After Tanya explained that the tools were for everyone, I have to admit, they've really helped.
I think that as we keep using the tools, we'll all feel more comfortable with them. And the great news is, we haven't had to stay late in the office for over 2 weeks now. My wife is a lot happier. And our patients are happier too because we're respecting their time.